Good day to you and welcome. Welcome into today's edition of Strategies for Living. I'm marriage and family therapist David McMillan. Delighted that you've tuned in, joined with me today on Strategies. Of course, Strategies for Living is all about helping us live healthier, happier, and more peaceful lives in our bodies, in our minds, in our spirits, in our relationships here in the 21st century. We do that by engaging in important conversations each and every time we do Strategies for Living with life strategists. We are going to engage in a very, very interesting and important conversation today with Dr. Paul Swingle. He is one of the eminent professionals and experts on neurofeedback. And we're going to learn a great deal about what neurofeedback and neurotherapy is and how it effectively treats ADHD, depression, autism, and even more. Dr. Paul Swingle is the author of Biofeedback for the Brain, and that book is out from Rutgers University Press. Dr. Paul Swingle is a registered psychologist in British Columbia. He's certified in biofeedback and neurotherapy. He was professor of psychology at the University of Ottawa, a lecturer in psychiatry at Harvard Medical School, and coordinator of the clinical psychophysiology service at Boston's McLean Hospital. He's now in private practice in Vancouver, British Columbia, and it is a delight to welcome him to Strategies for Living. Dr. Swingle, welcome.
Thank you very much for having me.
This is such an exciting prospect that we can treat ADHD, we can treat depression, we can even treat something like autism with biofeedback and neurofeedback. For many people, Dr. Swingle, that's mind-boggling.
Well, it's decidedly the new medicine. However, it's not new. It's been around for the better part of 4 decades. It's just not up on the radar screen for all kinds of reasons.
Well, I do think we need to get into those, because why, if this is certainly as efficacious as it appears to be, why haven't we heard more about it?
Well, the pharmaceutical companies spend something of the order of $6 billion in advertising. And last I heard, our association wasn't anywhere near that. I had an old professor when I was doing my undergraduate, and I was ranting and raving about something, and he sat me down and he said, "Paul, there's one thing you're going to have to know in your professional life. It's not science, it's politics." And that stayed with me for a long period of time. You know, neurotherapy is such an exciting area, but it's so simple. That doesn't mean it's easy. It just means the concept is simple. What we do is we look to see what kind of anomalies we have in the way the brain is functioning. And we do that very simply with surface electrodes, measuring the electroencephalogram. A lot of your listeners are familiar with that. You know, if they've had a seizure or stroke, or somebody in their family has, they do electroencephalograms in hospitals, in sleep labs, and, you know, they put you to sleep and measure your brainwave and so forth. It's exactly the same device. And what we're looking at is function of the brain. This is a little different than SPECT scans and MRIs and so forth, which are looking at structure. Now, the QEEG, the electroencephalogram, looks at brain function, and what we're looking for are anomalies in the way it's working. Now, we know what it should look like, so we have normative databases, and we can get in the difference between normal databases and clinical databases if we want to get technical about it. But the bottom line is we know what it should look like. When we see these departures from normal functioning, then we can tell the client, look, we've got this signature here, and this is usually associated with depression. So one of the very remarkable features about this, and what really impresses clients, is I don't ask them why they've come to see me. I tell them why they're sitting in front of me. And the data that we collect from the brain is that precise. Now, that's on the diagnostic side. This is the big change that's taken place. You know, we spend a fortune going around measuring things and then naming them.
Right.
And then everybody goes home. Neurotherapy is very exciting because it's based on the concept of neuroplasticity, brainwave plasticity, and there's a huge amount of research that's been done on it at NYU and University of California and so forth, that the brain is plastic. That is, you can self-regulate it, make changes in it. Now, if we were talking to some folks in the East, religious individuals from the East, and we said that, they'd say, well, we've known that for 10,000 years. Where have you been? So we find the anomaly, and we set it up so that the person can change brain functioning. And when you make the change, that is, you bring the brain into more normal functional ranges, the symptom improves. And it's really that simple.
So let's take a child who is having issues paying attention in the classroom.
Right.
And so many times, I know you've heard it, I've heard it, every clinician hears, I don't want to be too quick to put my child on medication. I'll do it if it's absolutely necessary, if he or she absolutely has to have it. But I just don't want to be too quick to go there. Is neurotherapy a solution for that?
Absolutely. There are many different forms of ADD, and there are a lot of conditions that mimic that, so that we get a lot of kids coming in here with seizure disorders, with trauma markers, and they're diagnosed as ADD or ADHD, and they want to medicate them. Now, there are certain forms of ADD that are associated with elevated slow frequency in the brain. Now, slow frequency is associated with daydreaming, early stages of sleep, reverie, and so forth, which is wonderful if you're sleeping and not doing anything and meditating. It's not so hot if you're sitting in a classroom trying to pay attention. For that form of ADD, what they usually use is a central nervous system stimulant. Now, that seems kind of strange. You know, you have a hyperactive kid bouncing off the walls. Why would you give a stimulant to that kid? Now, the reason for that is his bouncing off the walls is self-medicating behavior, that he is in desperate need for stimulation in the brain. So he's bouncing around. Now, if you give him a stimulant that stimulates the brain, it quiets him down. Now, the neurotherapeutic solution to this is why not suppress the excessive slow frequency in the first place? And we can do that with neurofeedback and neurotherapy. It's very simple. You put an electrode over the area where there's that excessive slow frequency, measure it, and then set it up so that when the brain is doing what we want it to do, icons move on a computer screen or an electric train moves around a track or whatever. So the child is playing a video game with their brain. When the brain is doing what we want it to do, Pac-Man moves across the screen. And the child learns how to self-regulate and suppress that excessive slow frequency. And therefore, the hyperactivity decreases, or the daydream.
This is exciting stuff. It's not new, but you may be hearing about it for the first time. And if you want to know more, the book is called Biofeedback for the Brain. It's an excellent book, how neurotherapy effectively treats depression, ADHD, autism, and more. Dr. Paul Swingle is our life strategist today. You can go online and check out Dr. Swingle's website, swingleandassociates.com, and you can actually order the book directly from the website. Do you have to link to the Sound Health products to order the book from your website, Dr. Swingle?
Yes, it will link to the website, but folks can just go to Amazon if they want. Amazon carries it.
Even something like autism. We hear more and more today about autistic disorders, and even that there's been an epidemic. Some people have used that term in the autism spectrum of disorders, autism and Asperger's disorder. So neurotherapy can be helpful in that area also, huh?
Absolutely. You know, when I was a kid, I'm pretty long in the tooth. But when I was a kid, if there was one autistic child in the entire school, it was a lot.
Right.
And now it's approaching one in about 120. People have been speculating about what's going on. You know, the notion that we have better diagnostic methods, that accounts for a little bit of it. But the fact of the matter is, you know, we are in epidemic proportions here. And I think a lot of it has to do with what we're doing to the environment. You know, the frailty of the infant brain and all of the nonsense we have in the environment now. However, that's, you know, I'm on my soapbox. What neurotherapy does is, again, look for the anomalies in brain functioning. And we can do a lot to help in the treatment of autism. It's not standalone. There are a lot of things that have to be done to help the autistic child. But neurotherapy has a very huge component in the treatment of these conditions. And it depends on whether you're dealing with Asperger's or various forms of the autism spectrum disorders.
It's interesting because really the kickoff of this, or a major kick of it, if you will, was almost by accident. A gentleman by the name of Dr. Sterman was doing a little research for NASA, right?
Yeah, that's a fascinating story. I love that. Barry and I are good friends. We go back a long time. What he was doing was he had a contract with the U.S. Air Force, and they were looking at the potential seizure vulnerability associated with rocket fuels that had hydrazine in them. Hydrazine causes seizure. So he was working with cats, and he had previously done an experiment with the cats to try to demonstrate that they could learn how to control brainwave activity. And the brainwave he was working with is called the sensory motor rhythm. He taught some of the cats how to increase their sensory motor rhythm, which was an interesting study in and of itself, right? It demonstrated that cats could control brainwave activity. But when that experiment was over, he used some of those cats in the pilot study with the hydrazine. He exposed some of the cats to hydrazine.
And that's that's rocket fuel, right?
That's right. To try to get an idea of what the seizure threshold is, you know, how much hydrazine was needed to provoke seizure.
Right, and of course NASA wanted to know that for the protection of their astronauts and
Bingo.
and other personnel that would be exposed to that may be exposed to the rocket fuel.
Absolutely, that was the whole purpose of it. What he found was that some cats were very resistant to seizure. That is, they had a very high seizure threshold. And he was puzzling about that, and he went back to look at the history of those cats, and he found that the ones that were most resistant to the seizure being induced by the hydrazine were the ones that learned how to increase the sensory motor rhythm. Bingo, we had a treatment for epilepsy, and that's one of the principal uses of neurotherapy now is in the treatment of seizure disorders. And it all came from that study that Barry did. Wow. This goes back 40 years now.
Right, right. And again, not to be overly negative, but again, I know that people like yourself, like Dr. Sterman, have feel like you're climbing a mountain, going up against to get this studied and researched at the same level that pharmaceuticals are studied and researched. And that's the mountain that really anything in neurotherapy is up against.
That's right. That was the principal motivation in my writing that book, Biofeedback for the Brain. See if we couldn't get it up on the radar. And there are quite a few neurotherapists around now, and there are neurologists who are doing neurotherapy, psychiatrists who are doing neurotherapy, in addition to a lot of psychologists. And psychologists had developed the procedure in the first instance. Well,
not to be too self-serving, but yours truly here in the Shreveport area And to be fair, there's another person here not associated with me that's also doing neurotherapy. Her name is Jenny Fouts. So if any of our listeners would like more information on a local level, give me a call or give Jenny Fouts a call at her office. Not to be too self-serving there, Dr. Swingle, but I thought I'd mention that because in our community, we're 300,000 or so population, and there's only 2 providers that I know of providing neurotherapy. And I'm fairly recent in it. Jenny, I think, has been doing it for 3 or 4 years prior to me. I'm excited about what I've seen so far in terms of the efficacy and the response have just blown me away so far. How people can be positively helped through neurotherapy. Had a lady that is in her 40s and came to me and was obviously chronically depressed. Within 3 neurofeedback sessions, her husband called and thanked me and said, you've given me my wife back. She's a different person. Number one, she's sleeping at night, but her mood during the day is just so changed. She's bubbly, she's bright, she's up. How common is that? How common is that kind of a story with neurotherapy?
We get that quite routinely. Now, there are a lot of variables associated with this. Chronicity is one. How long has a person been depressed?
Yes.
The second is, are they medicated? That's the big problem. If they come in highly medicated, you not only have the depression that you have a problem with, you have the medication that's a problem. And to bring them down off the medication. The type of depression that you're dealing with, as you know from the clinician's guide that you have that's associated with the book, there are many forms of depression. Some of them are much easier to deal with than others. However, as soon as you get a change in the brain activity associated with the depression marker, you get those responses.
Is there a norm in terms of the response level of most people? Is that a fair question? Because I know I'm not just talking about depression, but we would be talking across many, many different diagnoses, if you will. But is there a norm of number of treatment sessions to really make a difference?
It depends on how aggressively you treat. As you know from the guide, there are various levels of aggressiveness that you can use. Straightforward neurofeedback, I expect a person to notice some differences within 4 or 5 sessions. It's not over then, and I make sure that the patient understands. It's not over then, but you should be starting to see some changes, recognizing some changes in your behavior and mood state and so forth after 4 or 5 sessions. And that's generally the case, and that it is so enabling for a person, just the notion that they can start to modify their own brain activity that's going to give rise to these sorts of changes.
After that few hours.
Optimism is markedly affected by that, as you might imagine.
And this is so exciting. Alcoholism and addiction, even dementia, fibromyalgia and pain disorders. I've already mentioned seizure disorders, sleep disorders. One of the things that typically will really respond quickly are problems with sleep, right? Generally speaking, that's true. There are a lot of things associated with treating sleep disorders, Sleep hygiene is important as well. Absolutely. But something like fibromyalgia, and I don't know I don't have statistics here in front of me, Dr. Swingle, but again, as we were talking with autism earlier, a veritable epidemic of the problem of chronic pain, particularly the autoimmune problems like fibromyalgia. And neurofeedback can help that.
Yes, that's one of the conditions in which you see a profound change in the client after the first session. When you do the intake assessment and you show the client what the brain condition is associated with the fibromyalgia, it is life-altering because these individuals very often are virtually ignored by the general health community. And very often they're led to believe that nobody believes them.
Right.
That it's all in their head, and that they're just, whiny and, that kind of thing. That's the kind of impression they get when they go to professionals. And I love this when this happens. I say, did they send you to a psychiatrist? And did the psychiatrist say it was all in your head? And they laugh and they say, yes. And I said, well, of course. Where else would it be? And when I show them, generally speaking, what you find with fibromyalgia is excessive slow frequency up in the right side of the brain, front part of the brain, and a marked deficiency in the back, so that their stress tolerance is very, very poor. And when I show them that, it's just life-changing. The important thing about that intake is people understand that you understand what their condition is. And it's so huge in the treatment of somebody. They don't have to spend long periods of time trying to persuade you what the problem is.
Right.
You already know. You can see it in the brain.
And again, that's a very powerful thing, because at best case scenario, there are some physicians that do attempt to help and treat, but many times a person is told by their physicians, well, this is all we can do. So, you're going to have to just learn to tolerate this level of pain or this level of discomfort. That can be so depressing, if you will, for people, because they feel like my life has been taken away from me.
Exactly.
Alcohol and addictions. How does neurotherapy help there?
Well, we see a lot of folks with addiction, alcoholism, and so forth. And the first thing is to find out what kind of problem you're dealing with. The traditional genetically predisposed alcoholic has a very severe deficiency in the back of the brain. Now, what we do is we modify that. And by the way, there's nothing new about that treatment either. That goes back a long, long way. Research was done at Fort Lyons VA Hospital with hospitalized chronic alcoholics. The important thing with dealing with an alcoholic or another addict is they need a behavioral change as well. Change takes effort. There's no magic bullets here.
Right.
And what I say to an alcoholic is I sit them down and I say, look, I cannot keep you sober on a bar stool. And they get that message that, we're going to make modifications in brain activity, but they have to make lifestyle changes, that they don't hang around in bars. They just change the way they live their life. And under those conditions, you get somebody who's really committed to turning his life around and his life altering. And we have a lot of success with that. Now, the problem we have is that exactly the same problem all the rehab centers have, and that is individuals not fully committed to life change.
Right. Now, one of the things that you do in this book, in Biofeedback for the Brain, is you also introduce some of what you call partners in treatment with neurotherapy. What are some of the partners?
Well, we do a lot of craniosacral therapy. We do a lot of emotional freedom technique procedures, and what that is for your listeners is the procedures that use acupuncture points that you stimulate, and stimulation of acupuncture points actually changes brain activity. That's why it works.
Right.
And there are systems that we can use to help reduce anxiety and stress levels, so you can treat phobia with some of these things in addition to the use of neurotherapy. We've had
Gary Craig on the program here multiple times, as well as Roger Callahan a couple of times. Thought field therapy was Gary Craig launched emotional freedom technique out of the thought field therapy of Dr. Callahan. So we've had the good fortune to have both of those gentlemen on multiple times.
Yes, I have a paper coming out this month in Energy Psychology Journal on the brainwave changes associated with emotional freedom technique.
It's exciting to know that you can show the efficacy of that through the brainwaves and its manipulation thereof. What about what you call harmonics? What is that?
I've done a lot of work in the use of harmonics. I have a book out, Subliminal Treatment Procedures, A Clinician's Guide. And I've done a lot of work in the area of subliminals over the last 30 years. I started it when it was not a very popular idea, and the professional associations gave us all kinds of grief associated with working with something that they, of course, knew didn't work. In any event, what we're doing now is using sounds at sub-threshold levels, that is just below your ability to detect it. And we have harmonics that we use to treat ADD. These are the ones that suppress slow frequency. I was speaking earlier about one form of ADD, which is an excess of slow frequency amplitude. We have a harmonic that will suppress that instantly. And we use that instead of Ritalin for kids with ADD. And they use it, play it very softly in the background when they're doing their homework.
And people can go to your website, again, swingleandassociates.com, hook from there to Sound Health products, and order some of those harmonics to have directly in their home.
Yes, we have quite a few of them. We have them for sleep. We have them for ADD. We have them for depression. We have them for creativity. There's one that I treat a lot of artists with artist block, and Mozart is the name of that particular CD that helps with releasing the creative waveforms. And all of this, by the way, there's a lot of research behind each one of these, in which we look at how the brain wave changes when we expose the person to these harmonics. So this isn't just guesswork. We know what it does to the brain.
That's the exciting part. You can actually see what is positively happening in the brain. Where do you see neurotherapy in the future, Dr. Swingle? Where do you see this going?
Well, my mission is to see this in primary care. So if somebody comes into a physician's office and says, I'm feeling down, that rather than, use something like antidepressants, that the physician or the psychologist or whatever will do a few sessions of neurofeedback to correct the brain activity associated with that condition. That's really where I want to see it. And the second place I want to see it is in the school. There's no reason why we shouldn't be doing neurotherapy in schools for kids that are having learning problems, reading problems, dyslexia, ADD. They could be right there in the trenches. And there are some people who are doing that. I just had a colleague come up from Trinidad, and she's doing it in a couple of schools down there, and there's a fellow doing it in Wisconsin. One of the pilot programs was in New York City, in Yonkers, New York. So there are people that are trying to make inroads. Now, we've been trying to do it up here, and talk about politics, unbelievable. We were spending the better part of a year trying to get into a school, and we were going to give it to the school. We weren't going to charge them. We were going to just put it in there for free so that they could have a look at it. We actually brain mapped the principal and so forth and so on. After a year, they turned us down.
Wow.
Go figure.
Politics is everywhere. If you want to know more about this exciting work, then I thoroughly recommend Biofeedback for the Brain from Dr. Paul Swingle. It's out from Rutgers University Press. You can also go online and continue the conversation with Dr. Swingle there at www.swingleandassociates.com. Also check out Sound Health products, and you can do that all from Dr. Swingle's website. Dr. Paul Swingle, thank you so much for coming and being a part of Strategies for Living and helping us think about this exciting world of neurotherapy today.
It's been my pleasure.
Folks, thank you for tuning in to Strategies. If you enjoyed this conversation with Dr. Paul Swingle, know we do conversations like this each and every time we do Strategies for Living. So come back and join us often. Tell your friends about us. That's the way we grow here on Strategies for Living and strategiesforliving.com.